दिसतोय का?
Yes.
सुरू करूया.
Yes. करा सर.
आवाज येतोय?
हो हो.
प्रार्थनेने सुरुवात करतो.
अच्छा.
गुरुर्ब्रह्मा गुरुर्विष्णू गुरुर्देवो महेश्वरः गुरु साक्षात परब्रह्म तस्मै श्री गुरुवे नमः. तस्मै श्री गुरुवे नमः. With due respect to Swami Kvalananji, the organizer of this, Dr. Jagdish Naik, and all you yoga therapy teachers. Yesterday we were discussing about the Jalniti, and few of your students asked me one question about DNS. So I'm just showing you how it looks. See, this is the central septum. This is one nostril and this is another nostril. And you can see here, it has bent on this side. So what will happen? This side space will reduce. So that is called deviated nasal septum. So there will be less area. Again, you can see here. So this should be straight, but it has deviated on the one side. So this is deviated nasal septum. Now suppose, now here it is in the midway. Suppose it is at this level. What will happen if it comes over here? Air is going from here inside. This is the nostril. And from here it goes down. So here the space will be much less. And that's why you will be having difficulty in breathing. Then again, if you see from the front side, you can see here, this has turned on this side. So the nasal space inside the nostril has become less compared to, so you can compare it on this side and on this side. This is normal, this is straight one here. So both the side you can see the nostrils are having same space, but here on this side it has reduced. Okay. Now about the nasal polyp. Now this is a nasal polyp and this is seen where in the turbinate. See, these are the turbinates. So here these nasal polyps are seen. So suppose you are doing rubber niti. You are trying to push the catheter inside the nose like this. What will happen? It will go and hit on this. And why it is not going? Again, you will push it. So it will rub against this polyp and there will be bleeding. So the person who has got nasal polyp or who has got a very tight this DNS, he should not practice, because at this upper level, if this deviation is here, the rubber catheter may not go through this small opening. So again, if you try to push it, it will traumatize the mucosa and he may get bleeding. So the person who has got a nasal polyp or tight DNS, deviated nasal septum, he should not practice rubber neti, he should practice jal neti. Is it clear? So now we'll go to the next Jala Dhauti. Now Jala Dhauti, you know, the methodology, you have to take lukewarm water, about 5 to 6 glasses you should drink, sitting comfortably like this, and then you have to stand up, put your both arms over the knee and bend little bit forward and take your tummy inside and tickle the posterior pharynx. So you try to have the vomiting reflex, and then whatever water comes out, let it come out. You should not force it. You have taken 4 glasses of water and You have done it and only one glass has come. So why it is not coming? Again do it. That you should not do it. Whatever water comes, okay. If it doesn't come, don't worry. That also will give benefit. That we'll see now how it is benefited. So this is about Jala Dhauti. Now before going to the details of the benefits of Jala Dhauti, we'll just refresh our anatomy of the digestive system. Now this is the oral cavity. This is the tongue. Its digestive system starts from the oral cavity. Then this is the esophagus. Then this is the stomach. This is the liver. This is gallbladder. The liver secretes bile. That bile comes through this duct into the gallbladder. It is stored over here. And whenever you, you take food, when it is getting digested in the stomach, when the half process is over and when it is ready to go to the duodenum and ileum, jejunum, that time this bile is released from the gallbladder to the duodenum and small intestine so that the further process of digestion goes ahead. Now these are the small intestine. In this, the proximal part is called jejunum.
सर फिक्स हो गया है सर.
Hold, be relaxed. I think his net is.
ओके.
Unmute करा सर, unmute करा. Unmute करा सर, unmute करा.
Yeah. Am I audible now?
हे हो सर.
PPT दिसतोय का?
नाही. तुम्हाला परत मला हे करायला लागेल. थांबा.
ओके.
थांबा. नाही, तुम्ही करा. PPT तुम्ही ऑलरेडी आहात. हो दिसतंय.
Now, so this is the small intestine, this is the jejunum, and this is the ileum. Then this is the cecum. This is the ascending, that is large intestine, colon, ascending colon, transverse colon, and descending colon. Then this is the sigmoid colon, anal colon, and rectum. Who is this notorious chap? Anybody?
Appendix.
Yes, correct. Appendix. So in oral cavity, we have got 32 teeth, and then we have got a salivary gland which secretes saliva. When you do mastication, this food gets thoroughly mixed with the saliva and a bolus is formed. And then when you deglute it, because of the weight, it straight comes into the stomach. There it stays there for 2.5 hours. It is acted upon by hydrochloric acid and other gastric juices and enzymes, and then it is digested. Then it is slowly released through this pylorus into the duodenum, and then it comes to the jejunum. When it is ready to come to the jejunum, the bile is secreted from the from the gallbladder, and then it starts acting upon it. The 80%, 90% digestion is completed into the small intestine, and in the latter part of the small intestine, it is getting absorbed. When it gets absorbed, then it goes through the blood to the liver, and there it is stored. Now, remaining part, it comes ahead into the ascending colon, transfer and this. Here, some more digestion occurs. Then the bacterial flora, which is there into the large intestine, it acts upon and it produces vitamins. Then water regulation is done. And then finally it comes over here, which is in the form of fecal matter. When the fecal matter stays over here, this sigmoid colon goes on distending, and once it distends, it sends a message to the brain that it should be voided out, and that is how we get the call, and then we go to the toilet. Once we go to the toilet, then there are two sphincters. One is a voluntary and one is a involuntary. Voluntary means it is under our control, and involuntary is not under our control. So this involuntary, when there is distension, it opens up. But external sphincter, it remains closed. Suppose you got a urge to pass motion, but you don't have toilet facility. So what you do? You try to hold it. You try to postpone it. So how it is possible? Because the external sphincter, it is contracted because it is under voluntary control. You can open it up or you can close it. So once you get a facility of toilet, then you go to the toilet and then external sphincter opens up and you void the fecal matter. So this is controlled by the sympathetic and parasympathetic, and external sphincter is under voluntary control. Internal sphincter is under the autonomic nervous system control. So this is about the digestive system. Now, when food comes into the stomach, it stays there for 2.5 hours. It is digested and then it goes ahead. This is the pylorus. This is pyloric vein artery. Now, on this side is the stomach. On this side is the duodenum, and then this is the jejunum. Now, here hydrochloric acid is secreted. So here is the acidic medium, and here is the alkaline medium. Why I am telling you this? Because when acid is secreted, it acts upon the food and food is digested. But in a patient of hyperacidity, whatever food was there, it gets digested, and then excess acid, it remains over here. And if this acid crosses this line and comes on this side, it has got a corrosive action, and then ulcer is there. So if you don't want to have ulcer, duodenal ulcer or hyperacidity, what is the ideal thing? That there should not be excess acid and it should not go to this side, otherwise it will cause ulcer. And if it goes upper side, what happens? You say you get a heartburn. Jala Dhauti bolte na hum. So this acid, when it goes up into this direction, into the esophagus, you get a heartburn. Now behind stomach, this is a pancreas, Swadhupinda, which secretes insulin. And insulin controls the sugar level. So whenever there is a problem in pancreas, patient is likely to develop diabetes. So how can we keep it under control and how we can activate this pancreas? That also we'll see in the future lecture. Now these are the intestines, small intestine, and this is the large intestine. How many intestines are there? 29 feet. 23 feet small intestine and 6 feet large intestine. They are stuffed into the abdomen like this. One end is fixed over here, another end is fixed over here, and this intestine, small intestine, is floating into the abdomen, but it is connected to the posterior wall by this mesentery, ya parda. Now, whenever there is a obesity, जब मध्य प्रदेश आगे आ जाता है, तो there is lot of fat into this mesentery and into the wall of the intestine. Now these are the two kidneys. What is the function of the kidney? This is the kidney, then this is the ureter, and this is the bladder. This is the filtration plant of the kidney. Whenever blood comes over here, it is filtered. What filter? Kidney filters what is not necessary, what is excess, what is harmful, what is toxic. It is filtered here, and all the toxic matter is thrown out in the form of urine along this way to the bladder. And when bladder becomes full, again there are two sphincters over here, external and internal. Internal is a autonomic nervous system, involuntary, and external sphincter is a voluntary. So whenever we feel urge to pass urine, when the bladder is distended, you get a call. But if you don't have facility, you try to hold it by closing the external sphincter. When you get a facility to go to toilet, external sphincter opens up and you avoid the urine. Now you must have heard patient getting stone somewhere. Where patient gets stone? Either into the kidney, ureter, or bladder. How we can get rid of it, that also we'll see in future slides. Now we have seen the basic anatomy and physiology of the digestive system. Now we'll see what benefit you get by doing Jala Dhauti. Now when you're doing Jala Dhauti, what you do? You drink about 5 to 6 glasses of water. So it will come into the stomach. What is there into the stomach? Acid is there. So that acid will get diluted. If the acid gets diluted, its nuisance value will become 0. And what we are doing? We are vomiting it out. So if you are vomiting it out, that acid will not remain here. So there will not be hyperacidity, and it will not go to this side or that side, and you will not get heartburn or ulcer. So this benefit you get by doing Jala Dhauti. Now, what is the ideal time told to you for doing Vaman? Yes, anybody?
Early morning.
Right. So why early morning time is given? Because when you take your dinner, suppose 8 o'clock, 9 o'clock, 10 o'clock, you take the dinner and you go to bed. After 3-4 hours, all the food is digested. And after 2 a.m., what remains into the stomach? Excess acid. In a patient of hyperacidity, when you advise to do Vaman in the morning, that time what is the position? After 2 a.m., there is the collection of the excess acid. And when the level of this acid rises, because continuous acid secretion is going on in hyperacidity patient. So at the morning, in the morning at 6 o'clock, when you get up, that time the acid level is very high. That time if you drink 5 to 6 glasses of water, dilute it and throw it out, then you will not get the problem of the acidity. For example, suppose you take a sulfuric acid concentrated, 1 teaspoon. And if I tell you that take it on your palm, will you take? Why? Because it will burn your hand. But same 1 teaspoon of acid, if I put it in 1 full bucket of water and empty that bucket on your body, you will not realize that it was containing acid. Why? Because it was totally diluted. Similarly, by drinking 5 to 6 glasses of water, you dilute the acid and then throw it out. So it will not remain here and you will not get acidity or ulcer problem. So this one benefit you get by doing Vaman. Is it the only one benefit? You must have experienced, you have taken 5 to 6 glasses of water, but only 2-3 glasses of water might have come out. So what happens to the remaining water? The remaining water, it will go ahead along this pathway, along this 29-feet intestine. So what will be the outcome? All these intestines will be cleaned. If all intestines are cleaned, their function will improve. Now, what is the function of intestine? digestion of the food. So your digestion will improve. You will not have digestive problem. Now some of this water, when it will come over here, here is the fecal matter. So the water content of the fecal matter will increase. If the water content of the fecal matter has increased, the fecal matter will not be hard. If the fecal matter is not hard, you will not get hard stool and you will not get constipation. So you will get relief from constipation. So this benefit you get by doing Vaman. As you know that if there is somebody from Ayurveda science, if you go for a Ayurvedic treatment, you will find that they give different types of medicine. 1 minute. They give different types of medicine. You ask them, what is this, what is this, what is this? So they will tell, this is for this, this is for this, this is for this. And what is this? This is for your constipation. कोठा साफ करने के लिए या पेट सफा करने के लिए. Now why they give that to all the patients? Because Ayurveda science says that sarva roga jayante prajayante mala sanchayat. All the diseases, they start from constipation. So unless and until the constipation is relieved, you are less likely to get the relief. And that is why all the medicine, Ayurveda medicine, they contain one of the is the what you say, not purgative, but clearing the constipation. So by doing Vaman, if the fecal content, water content of the fecal matter increases, it will not be hard. If it is not hard, you will not get constipation. And if you don't get constipation, the root cause of the diseases is reduced. So chances of getting diseases are also reduced. So that is why this is the outcome of the Vaman. Now what more benefit you get? Now you have taken 5-6 glasses of water, only 2 glasses or 3 glasses have come. Remaining 3 glasses water has gone ahead. One of the glass of water, when it comes into the small intestine, it gets absorbed. Because what is the function of small intestine? To digest the food and absorb the nutrients. So water will also get absorbed. So this water, when it gets absorbed, it will go into the blood. When this blood is circulating, it comes to the kidneys. Kidneys will say it is excess. So it will filter it out. And if it is filtered out, what will happen? Patient will have excess urination. Even you also must have experienced, whenever you are done Vaman, after that, at least 2-3 hours, you get lot of urination. Now, because of the excess urine, because of the pressure of the excess water into the urine, if any small particle is there in that path, it will be pushed ahead. If it is pushed ahead, it will not remain over there. If it is not remaining over there, what will happen? It is pushed out, and if it is small size, it will be thrown out through this. So if there is any small stone, it will be pushed out, so you will not get stone problem. So this benefit you get by doing Vaman. But remember that the sludge or stone, it should be less than 4 millimeter diameter. Why? Because see here, the ureter, this is ureter, these are the vena, aorta and vena cava, and these are the femoral arteries. At this crossing, because of this, there is a little narrowing of the ureter. And at the entrance of the bladder, it is little narrowed. So the diameter of the stone should be less than the diameter of the ureter over here and over here. Otherwise, what will happen? Suppose there is 6 millimeter stone. So it will get stuck over here. It will not go ahead. So if the stone is less than 4 millimeter or the sludge is there, when you do Vaman, after that, when the excess urination is there, because of the pressure of the excess water into urine, this sludge or the stone less than 4 millimeter size will be pushed in the bladder and it will come out along with the micturition. So, Dhauti will help to clear the sludge into this passage or stone less than 4 centimeter in passage so that you will not get stone problem. So that is how you get relief by doing Vaman and you will not get stone problem. But remember, any stone will not be possible to be treated with Vaman, because if it is 6 millimeter or 8 millimeter, what will happen? If it is here and you are done Vaman, so lot of water has filtered and it come over here, and this stone is over here fixed. It is not going ahead. So what will happen? This water which has come over here, it will not be able to pass ahead and it will remain over here and the kidney will swell. That is called hydronephrosis. So remember, stone less than 4 millimeter of the size or sludge is there, then only your Jala Dhauti will help to get rid of that, but not the stone more than 4 millimeter or 6 millimeter. Is it clear? Otherwise, oh, the benefit I had told that you can get rid of the stone. So any patient having stone, you will tell him, okay, you do Vaman and it will be relieved, but not. If it is less than 4 millimeter, then only it is possible. If it is of bigger size, patient will have problem because the water will remain over here. There will be hydronephrosis and kidney damage will be there. So remember this. If it is less than that, then only you should ask him to do Vaman. Now, what more benefit you get? When you are doing Vaman, the acid is washed out. So acid level will become reduced. For example, suppose you go out for some work and you are supposed to come at home for lunch at 2 o'clock. But because of the work pressure, you might not be able to come home at 1 or 2. And you come late at 4, 4:30, 5 o'clock. And what is your first reaction? You all ladies must be having that experience when your husband comes home at 4 o'clock, 4:30, and whole day he has not eaten anything. What he says? Give me food first. I am very hungry. पहले खाना खिलाओ, बाकी बातें बाद में करो. मेरा पित्त खौल गया है. What do you mean by pitta khol gaya? Since morning he has not eaten anything and acid is secreted continuously into the stomach. Now this acid sends message to the brain, get me something to eat. And because of the repeated message, you get headache. Or that's why he says, मेरा पित्त खौल गया है, पहले खाना खिलाओ, बाकी बातें बाद में करो. And then what happens? He eats more because lot of acid is there, so he eats more. If you are doing regular Vaman, the acid secretion will be limited. If the acid level is limited, you will eat limited food. If you are not eating excess food, you will not get obesity. You will not get the tummy. So this benefit you get by Madhya Pradesh आगे नहीं आएगा. So this benefit you get by doing Vaman. So what are the benefits you have seen? You will get relief from acidity. You will not get ulcer. Then you will not get overweight. You will not get stone. Acidity remains under control. No chance of developing ulcer. Reduces constipation. If the hard stool is not formed, what will happen when there is hard stool? When it comes through this, it rubs the mucosa and you get fissure in ano or piles. So that also problem will not be there. No urinary stones, acidity level, low demand of food, so overweight will not be there. So usually it is better or beneficial in the obesity people to give Vaman so that their weight will reduce substantially. But remember that I will take in the next slide. If it is contraindicated for a obesity person, then you may not be able to give Vaman. Now, chances of gallstone and pancreatic stones also reduces. Now, This is the gallbladder. Now, liver secretes bile and it is stored into the gallbladder. Now, the size of the gallbladder is hardly it can contain 50 to 100 cc of the bile. But about 1 liter or 1.5 liter bile is secreted by liver. And if all this comes over here, what will happen? This bladder will burst. So what happens? Whenever the bile is secreted, it comes here into the gallbladder. It is a storehouse. So to accommodate next lot of the bile, the water content of this bile is absorbed. And that is how it tries to maintain the size of the gallbladder and accommodate the 1 liter secretion of the bile. Now, more the secretion is absorbed, this may become concentrated. And if it becomes more concentrated, and if there is an obstruction over here, because bile comes through this cystic duct into the duodenum. If this opening is blocked, what will happen? The bile will not be able to come into the duodenum. It will get stasis over here. And because of that, it may form stone into the gallbladder. पित्त की थैली में पथरी होती है, पित्ताशय में, that is gallbladder stone. Now remember the two words, pitta. The pitta into the stomach is hydrochloric acid. And pittashay or gallbladder, this is a bile, not the acid. So when it gets more concentrated, it may form stone. So you may get gallstone. So if you are doing similarly, pancreas secretes pancreatic juices, and through this is the pancreatic duct. Now these pancreatic juices, they are collected by this and they are thrown into the duodenum through this opening. Suppose this opening gets blocked because of the debris or food particles into the duodenum. What will happen? These pancreatic juices may not be able to come into the duodenum. The bile may not be able to come into the duodenum, and there will be stasis. And when there is any stasis, waterlogging, what will happen? They will form stone. Now, if you are doing Vaman, this water, when it is flowing through this, it will not allow any dust particle or food particle to stay over here to block the opening of the bile duct and pancreatic duct. So chances of developing gallstone and pancreatic duct are reduced if you are practicing Vaman regularly. So this benefit you get by doing Vaman. So these are all the benefits you get by doing Vaman. That is why you should be practicing Vaman. So how many days you will practice? Every day? Because it is so beautiful, so you should practice every day, isn't it? Anybody? Yes?
Once in
Yes
a week.
or no? Yeah, but why not daily?
The acid levels will become reduced continuously if we are.
Yes, correct. If you practice every day, what will happen? Acid is thrown out. So one day acid level will become 0. And acid is the first step of digestion. That is why we require optimum acid, and that is why we will do once in a week, or as a beginner, you can give him for first 5-7 days so that whatever acid is collected, it will be thrown out. And then you can practice once in a week. Or suppose you go out for some food and it was very spicy and very oily and you are getting lot of acidity, you can do it. That is called By Dhauti. That means you do it 2 hours after the food, so that whatever excess acid was there, it will be thrown out. So once in a week, and if there is a lot of acidity after the food, if you have taken a lot of spicy food, then you should do 2 hours after the food. That is called By Dhauti. Now, such a beautiful dhauti. One more precaution, you are going to be yoga teacher. So when you teach the patient that you have to do Vaman like this, you will tell him that make lukewarm water, then sit like this, then drink slowly, and then stand up and then do. One more tricky question you should ask, and we should give that you should follow this. What is that? What you will ask the patient? What precautions you will ask him to take?
Empty stomach.
Okay, that is, we have seen that Vaman is advised early in the morning. The reason we have this I have seen. Anything else? Okay, we'll go first and then we'll come to that question again. Now, such a beautiful dhauti. Still, some people cannot do it. Now, who are they? The patient who has got high BP, who has got heart disease, who has got abdominal hernia, who has got major abdominal surgery, who has glaucoma, means there is an increased pressure into the eyeball. That is called glaucoma. Then in pregnancy, in the gastric ulcer, complicated ulcer, pyloric stenosis or bleeding ulcer, and physically weak person. Now, why it should not be done in high BP, heart disease? See, when you drink 5 to 6 glasses of water, it comes over here. Then you try to stand up, tickle the posterior pharynx, take your tummy inside, and create a pressure onto the stomach, and that is how the water comes out. Okay. When you are pressing your tummy inside, these intestines, they press onto the stomach and the water is pushed ahead. Above stomach, what is here? Yes?
Lungs and the
Heart.
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 Heart. So there will be pressure on heart. So the patient who has got a heart problem or who has got high BP, he should not practice Vaman. Otherwise, we will get more problems. Now, I told about the hernia. What is the hernia? The abdomen is called a magic box. And it has got 6 openings. Now, here the esophagus comes down through this opening into the diaphragm. Then in umbilicus, then there are 2 openings into the groin, inguinal. So these are small windows. When pressure increases inside the abdomen, these intestines, they push themselves out through the umbilicus, that is called umbilical hernia. Through the inguinal region, that is called inguinal hernia. Now, whenever there is increase in the pressure into the intra-abdominal pressure, the intestines are pushed out. Now, when you are doing Vaman, after drinking water, you are taking your tummy inside, pressing the intestines, which will press on the stomach. So if anybody has got hernia, that means that intestines are coming out through this groin. What will happen? Because of the pressure, they will still come more. So if the hernia is small, it will become big. So the person who has got hernia, he should not practice Vaman. Now, suppose somebody has undergone operation, surgery. What we do? We cut over here like this. We do whatever operation we want to do, and then we again close it. Now, this anterior abdominal wall is made up of 7 layers. When we cut it, we open it, we do the surgery, and again we close it layer by layer. Sometimes what happens, this wound does not heal properly, and then it becomes a weak part. Now, suppose he is doing Vaman, when there is an increased intra-abdominal pressure because of the pressure on the intestines, this weak scar, it may give way and intestines may come out through that. That is called incisional hernia. So, the patient who has got major abdominal surgery or hernia, he should not practice Vaman. Then glaucoma. there is increased pressure into the eye. Now, when you are doing Vaman, you are pressing on this. Here, what is two major structure? This is the aorta and this is the vena cava. Now, when you press intestines, they also press on this. So this pressure is transferred to the upper vessels and vessels going to the eye, and that is why the pressure into the eye may increase. So the patient who has got glaucoma, he should not practice Vaman. Then in pregnancy, here will be the uterus which is containing fetus. Now when you are doing Vaman, you are taken 5 to 6 glasses of water and then you are pressing tummy inside. So what will happen? It will press the uterus which is containing fetus. So sometimes it may lead to abortion. So that is why in pregnancy you should not practice Vaman. Then coming to the gastric ulcer. Now this is the stomach. Peptic ulcer is classified into two. One which is there into the stomach, it is called gastric ulcer, and one which is into the duodenum, it is called duodenal ulcer. Now what is the peculiarity and difference between these two? Gastric ulcer is usually seen when the patient's stomach is containing less acid. That is called achlorhydria. In the gastric ulcer patient, the gastric acid level is already low. Now, if this patient performs Vaman, what will happen? Whatever little acid was there, it will be also thrown out. So, the condition will worsen. So, the patient who has got gastric ulcer, you cannot give him Vaman. But suppose patient has come to you. Nowadays, because the yoga has become known worldwide, patients, no, I want to practice yoga, everything can be cured, so I also want to get. You can give him other practices. Why? Because we have seen what is the basic cause of acidity. First is the 50% is caused because of the, more than 50% is because of the mental tension. And nowadays, everybody has got tension. Remaining 30-40% is because of the spicy food and bad habits like drinking, smoking, tobacco chewing. So, 50% is because of the mental tension. Now, mental tension for reduction, we can give him Omkar, Gayatri, meditation. So, yoga you can give, but not the Vaman. Another thing, when a patient of gastric ulcer, suppose a patient of ulcer comes to you, you ask him to show the report. You will see whether it is a gastric ulcer or a duodenal ulcer. If it is duodenal ulcer, the acid level is already low. And if you give Vaman, the acid will still reduce and patient will have more problems. Another thing important, gastric ulcer is very notorious, is known to get converted into cancer. The gastric ulcer more than 2 centimeter diameter is 90% chances that it will get converted into malignancy, cancer. So, if a patient of gastric ulcer comes to you, he has shown you the gastroscopy report, and there if it is written that he has got gastric ulcer, usually they also will mention the size of the ulcer. So, you have to see this report first. Second thing, if it is gastric ulcer, you can give all yoga practices except Vaman. And another thing, since it is notorious to get converted into cancer, you should tell patient that you should be under the supervision of the doctor, treating doctor, who will repeat his gastroscopy and see whether the size of the ulcer has increased. If the size of ulcer has increased, usually you do biopsy. And if that biopsy says that it is malignant, then cancerous, then that stomach has to be removed. So remember, otherwise what will happen? It has happened. I have seen such patients that they were having gastric ulcer. They told that gas ulcer hai, and they practice yoga, and after 6 months they develop pakka cancer, and then I was practicing regularly yoga, and how can I got cancer? And yoga will be blamed. So you should see that if it is a gastric ulcer, you should ask him to be under supervision of doctor. He will repeat, because usually if the patient of gastric ulcer is given conservative line of treatment, we ourselves repeat the gastroscopy every 3 months and see whether it has increased in size. And if it is an increase in size, we immediately take a biopsy and see whether it is malignant. If it is a duodenal ulcer, there is no problem. Now, how to differ? Suppose he has not brought the gastroscopy report. How you will differentiate whether he has got a gastric ulcer or a duodenal ulcer? Now, if it is a gastric ulcer over here, suppose somebody eats, the food will come and hit over the ulcer and he will get pain. So the gastric ulcer patient will avoid eating food. He will be very much cautious. उसको डर लगता है खाने के बारे में, क्योंकि खाएगा तो दर्द ज्यादा होता है. But contrary to that, duodenal ulcer patient, because it is excess acid which has gone over here, that is why he has developed ulcer. If he eats, what happens? This acid will be utilized for digesting food and it will not go ahead and the pain will be relieved. So I understood the difference between the gastric ulcer and duodenal ulcer. Suppose patient comes to you and he says that I have got ulcer and I want to practice yoga. So how will you confirm that it is gastric ulcer or duodenal ulcer? So ask him, okay, do you get pain relief by eating food or whether you get aggravated pain? If he says, no, and usually the thing is that gastric ulcer patient will not eat. He says, नहीं मुझे डर लगता है खाने का, खाना खाएगा तो दर्द बढ़ जाता है. He will say that if I eat food, the pain increases. But contrary, duodenal ulcer patient will say, moment I start getting burning, I eat something and then I feel relief. So that means it is a duodenal ulcer. Gastric ulcer and duodenal ulcer. So once you confirm it, then you can give him yoga practices. If it is a duodenal ulcer, again, I have told here, complicated ulcer, pyloric stenosis or bleeding ulcer. Here again, you will not give Vaman. Why you will not give? See, this is the duodenum. This is the stomach. If it is gastric ulcer, the ulcer will be into the stomach. If it is into the duodenum, it is duodenal ulcer. Now here, because the acid keeps on going here and corrosive action, patient develops ulcer. Now, suppose you get some injury over here. Today you got injury and you told me, doctor, I was having some injury over here. And suppose we meet after 6 months or 1 year. Then I will ask you, that day you told me that you had an injury on the hand. Where is it? Show me. Then what you will do? You will try to search it. And the way you had injury, the length was this much. But after 6 months, it becomes half of it. It shrinks. Similarly, when patient gets ulcer over here, after few days it heals. So what will happen? This part will become narrow because of the fibrosis. So this opening becomes narrow and that is called pyloric stenosis. Now, if the pyloric stenosis patient is there, that's why I said gastric ulcer, you will not give Vaman. If it is a pakka duodenal ulcer, and if there is a complication like this pyloric stenosis, you will not give him Vaman. Because if this part has become narrow, and if he drinks 5 to 6 glasses of water, since it is not able to go ahead, the stomach will distend and he may get discomfort. So you will not give him Vaman. Complicated peptic ulcer, one is a pyloric stenosis, where the path has become small. This has become narrow. Another thing is the bleeding ulcer. Now, suppose patient gets ulcer over here, duodenum. Now, this is the inner side of the duodenum. This is the mucosa, and patient gets ulcer over here. What do you mean by ulcer? Can you tell me? What is the definition? Ulcer is the breach in continuity. Pit. रास्ते पे आजकल देखते हैं ना, खड्डे बहुत है. The smooth road is not there. There is a pit over here. So that is ulcer. This is a breach in continuity. Now suppose this is the area, ulcer is there. So this mucosa and this mucosa, there is a dent over here. So below that, what is there? What is this? Yes. What is this?
The arteries or
Artery.
veins.
Arteries.
Blood vessel. Correct. Now, if there is a dent over here, so you can see directly the artery or vein. And if this patient tries to do the Vaman, when is exerting, there may be erosion and it may burst open and blood may flow into the duodenum and stomach, and he may bring out blood into the vomitus. So the patient who has got complicated peptic ulcer, like pyloric stenosis or bleeding ulcer, he should not practice Vaman. Okay. Now, all these things I have told. So, what questions you will ask any patient before giving him, advising him Vaman? What will you ask? Yes.
सर फर्स्ट ऑफ ऑल उनको पूछना चाहिए आपका हार्ट का कंडीशन कैसा है, आपका बीपी कैसा है, आप बीपी का टैबलेट लेते हैं कि नहीं, या फिर आपका ओबेसिटी होगा तो
Okay.
उनका थायराइड का कुछ प्रॉब्लम है कि नहीं, वो भी पूछ सकते हैं. और आंखों में कोई
Okay.
परेशानी नहीं है अकॉर्डिंग टू ग्लूकोमा. प्रेगनेंसी तो हमको
Yeah.
वो आने से ही वो हमको समझ में आ जाएगा. और गैस्ट्रिक अल्सर
पता
मतलब
जाएगा. Correct.
बर्निंग होता है क्या, और खाना खाने के बाद आपको कुछ क्या बोलते हैं अनइजीनेस फील होता है क्या, इससे भी पता चलेगा. और फिजिकली वीक पर्सन तो
दर्द
हमको आंखों में देखने से ही पता चल जाएगा.
दर्द खाने से बढ़ता है क्या कम होता है, तो
हाँ.
इसका आपको whether it is a gastric ulcer or duodenum is actually negative. Any more question you will, or precaution? Any more? One more. Or I will give another clue for you. Suppose you have advised the Vaman to any patient, and he has gone, did Vaman, and next day he came running. Oh, sir, the water vomitus came out. It was all red water. He got frightened.
सर ब्लीडिंग अल्सर
Yes. Anything else?
Peptic ulcer.
And what advice you will give him? Suppose he comes and tells you that I had a blood into the vomitus. What you will advise him?
इमीडिएटली स्टॉप करने के लिए बोलेंगे.
Correct. And
और गो टू द डॉक्टर फर्स्ट बिकॉज ब्लड आ रहा है तो ये.
हाँ, तो confirm whether you have got ulcer, bleeding tendency, all that. One more question. Anything else? Common sense question. Yes? Anybody?
Diarrhea, we will ask if you have.
I'm giving you clue.
भूख अच्छा लगता है या नहीं, टाइम पर लगता है. नो.
What I'm showing you.
ओ ओके, वो जब
Nails.
नेल्स से अगर अंदर कट लग गया धोती करते समय जब डालेंगे
हाँ
फिंगर्स अंदर तो
हाँ, तो क्या 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 एडवाइस करना है उसे?
नेल कट करके हमेशा जो है।
हाँ, नेल्स ट्रिम किया है कि नहीं देखना. So when you will advise any patient woman, first ask him whether you have got a heart problem, blood pressure, or any operation has been done, or there is a आँख का problem है क्या, gastric ulcer है क्या, और नाखून काटा है कि नहीं. That you have to see. Otherwise, he start, oh, why water is not coming? He will do it, and it will traumatize the mucosa, and he will get bleeding. Okay. Now, we are told that Dhauti is such a good thing, but all these patients should not practice Dhauti. Then what they will do? So, they will not practice Vaman, but they can drink 2 glasses of water in the morning after brushing and don't take anything for half an hour. So, what will happen? When they take 2 glasses of water, it will come over here. It will dilute the acid and slowly it will go ahead. Since it has been diluted, nuisance value has become less. So the corrosive action will not be there and at least 50% benefit you will get. So these are all the pros and cons of Vaman. Any question on this? Then otherwise I will go to the next Kriya.
Sir, to drink water means normal lukewarm water or with salt? Just to drink.
It is lukewarm water and little salt is added. It has got a emetic action. That is why salt is added. But once you become seasoned with that, you need not add salt. You can take direct water. Another thing, usually question is asked, or you will also face this problem. If you ask the patient, do you have blood pressure? He'll say, no, normal blood pressure. Now, what do you mean by normal? You should categorically ask him, because what he tells, with the medicine, his blood pressure is normal. But that patient also is a case of blood pressure, so he should not be given Vaman. Remember, if you ask the patient, blood pressure hai kya? Normal blood pressure hai. Normal blood. Next question you should ask, are you taking medicine for blood pressure? Because what he says, with blood pressure, with medicine, my blood pressure is normal. But he is a patient of blood pressure, so he should not be given Vaman. Anything else?
So
one more thing.
Sorry, Avinash, continue.
Sorry. So for a normal person, with a healthy person, can he perform normally after drinking the water before taking out?
Because if you're drinking 5 to 6 glasses of water, the abdomen is already distended. And what is Nauli? Nauli is the movement of the rectus muscle, which is there in the anteabdominal wall. So it is not possible to do the Nauli when your stomach is full. Because all yogic kriyas you are supposed to do at an empty stomach, isn't it? Now, stomach is full because of water, not because of the food, but because of water. So, Nauli is not to be done.
Okay, sir. Thank you.
So patients come with high acid reflux. Are we supposed to avoid completely? Or if it is in the beginning stage, can we give?
If it is just acid reflux, then you should see that whether he gets that burning sensation, heartburn, that means it is hyperacidity, you can give them. But if the acid regurgitation is, see, there is a wall over here, gastroesophageal wall. So it doesn't permit the food to go up into the esophagus. But if this wall has become relaxed, then this may go up, and this is acid which goes up, and that causes corrosive action, and acid reflux is there. So if it is a lax opening, then you should not give him one, because in that case what will happen? It will still become more lax.
Right.
So
Okay,
that
sir.
case, you should ask him to only drink water and wait.
Okay, sir.
GRDS, you must have heard,
Yes, sir.
gastroesophageal reflux disease.
Disease.
So if it is diagnosed GRDS, you should not give Vaman,
Okay, sir.
because it will still make the this valve satulous, and more acid will go up and he will get more symptoms.
Yes, sir. But it is okay for them to drink 2 glasses of water at a stretch in the morning and wait for half an hour.
Yes.
Okay. Yes, sir. Thank you.
So the normal person can do this once a week, but how about the person who is already facing this hyperacidity problem? How many times they should do?
See, a patient who has got hyperacidity, he has got no ulcer, that patient can practice the Vaman for first 5-7 days regular, daily. And once the acid level comes down, then you can do it once in a week.
Okay, sir. Thank you.
सर ये गैस्ट्रिक अल्सर और डियोडेनम अल्सर दोनों में ही एसिड का प्रोडक्शन ये कम हो तो
ड्यूडेनल अल्सर में एसिड प्रोडक्शन ज्यादा है,
अच्छा
गैस्ट्रिक अल्सर में एसिड प्रोडक्शन कम है. It is less. That is why it is called achlorhydria.
ओके गैस्ट्रिक में कम होता है और यहाँ पे ज़्यादा होता है ओके
Yeah.
और सर और एक है एब्डोमिनल हर्निया या फिर हर्निया का मतलब समझ में कैसे आता है ये तो एक तो मेडिकल कॉन्सेप्ट से समझ में आता है वो टेस्ट करवाने के बाद से या फिर मुझे है कि किसी को है इसको मतलब सिम्टम्स क्या होते हैं
Usually, when we'll learn about hernia, we'll go in detail. But at present, just I will tell you, as I told you, there are 6 small windows to this abdomen. And if it is weak window, then this intestine, when there is a pressure on the intestine, they will come out through that. And usually patient will tell that I have got a swelling over here which increases on coughing. Inguinal hernia जो है तो groin में होते हैं. Umbilical hernia is near the umbilicus. So he will tell, if I cough, it becomes big in size. If I lie down, it vanishes. So that patient will tell. And if a patient has undergone any surgery, abdominal surgery, ask him that scar is healthy. Is there any swelling coming over the scar? That means it is an incisional hernia.
ओके सर ओके थैंक यू
Should I go ahead now? Okay, so next is the Kapalbathi. Now, Kapalbathi, traditional Kapalbathi is a normal inhalation and forceful exhalation. Now, this Kapalbathi, you can do as a beginner for 20 to 30 times as per your capacity. And then slowly you can go on increasing it up to 120 maximum in one set. You should not practice more than 120 per stroke, per set. Such 3 sets you can practice. Why we should not practice 500 times, 1000 times, that we'll see at the end of the Kapalbhati. Now, before going to the discussion on benefits of Kapalbhati, we'll first see the physiology and anatomy of the respiratory system. Now, it starts from the nose, then this is the pharynx, then this is the trachea. At the center of the chest, trachea divides into 2, then it branches, and ultimately these are alveoli. How many alveoli are there? More than 7 crores. If you take out all these alveoli and try to make a straight line, it can be a few kilometers. Suppose you take out both the lungs out on the table and try to inflate it with the pump. How much area it can occupy, you know? Half the lawn tennis court. Such a huge capacity lung is situated in our chest. Now this mucosa lining inside the trachea and bronchus, it has got hair-like projections. That is called cilia. See, these are the hair-like projections. Can you see this? Here also you can see. This is the trachea and bronchus. Now, what is the function of this cilia? When you are breathing in air, in the atmosphere, there are a lot of dust particles. Or even if you are walking on the road, lot of dust particles are there. So when you inhale, they go inside. So if you are standing in a construction site, so all the time dust particles are coming in, dust particles are coming in. So in 1 year's time, your alveoli will become full of dust particles and they will not be able to function at all. But is it happening like that? No. Why? Because whatever dust particles they come inside, they get entangled into the cilia, and because of the escalation action, these dust particles, they are not allowed to go in, they are pushed out. As you know, on the airport, you find an escalator. The bag is put on this side, automatically it goes out, it doesn't come back. So similarly, these dust particles, they are not allowed to go to the alveoli, they are thrown out. So this important function is done by this cilia. Now this mucosa lining the trachea and bronchus, it secretes 1 liter of water in 24 hours. Now what is the function of this water? Whatever air you are breathing in if it is in dry season, summer season, the air is very dry. And if that air goes inside, it may damage the mucosa of the bronchus. That is why this air is moistened with the help of water. That is why in summer season, usually most of the water is utilized for moistening the air which you are breathing in. But in winter season or rainy season, you don't require that much because air is already wet. So the water may remain over here and it may cause problems. That is why respiratory problems are more seen in the winter season and rainy season. Now this alveoli, they contract and relax, and there is this is the artery and this is the vein. Through this comes the impure blood which contains lot of carbon dioxide. When it comes over here and air comes through this into the alveoli, and here there is an exchange of carbon dioxide and oxygen, and the blood which has come over here, which is having excess CO2, the CO2 is given and O2 is taken, and that blood becomes pure, and then it goes back into this to the heart, and then it is supplied to the body. So this process is going on continuously. Now the respiration is controlled by the centers into the brain. Such a huge important lung is situated into the thoracic cavity. This is lined by these ribs, and then there is a diaphragm below it. The intercostal muscles, the muscles in between two ribs, when they contract, the anterior-posterior diameter of the chest cavity increases and diaphragm goes down. When it goes down, the area increases into the chest cavity, and that is how we breathe in. This is the diaphragm, and when you breathe in slowly, normally, the diaphragm comes down only for 1 centimeter. When you breathe in heavily, that time it can come down 7 centimeters. More the diaphragm can come down, more the space is made available, and more the air you can breathe in. So that is how the respiration goes on. Do you know the mechanism of respiration? How the respiration happens? Okay, I will tell you. Now this is inhalation. How inhalation is possible? When you have to breathe in air, this diaphragm goes down, the intercostal muscles contract and the thoracic cage size increases. When the thoracic cage size increases, the water lung is there inside, it gets more space to expand. When it expands, what will happen? The lung size has increased, but the air content is same. So air will spread out. Now, when the air spreads out, what happens? The pressure of air inside the lung will reduce. And what is the principle of the movement of the air? Air always move from the high pressure to the low pressure. So since the diaphragm has gone down, the intercostal muscles has contracted, the anterior-posterior diameter of the chest has increased, the lung gets more area to expand. When lung expands, the air inside the lung also spread all over there, and the pressure of the air inside the lung reduces, and that is why the air from higher pressure moves into the lung, and that is the inhalation. Now, when you are inhaled, the oxygen has come in, it has been taken by the blood vessels, and alveoli contains more of the CO2 which has been taken from the blood vessel. So the CO2 level into the alveoli will increase. Now, when the CO2 level into the alveoli increases, it sends a message to the brain throughout this air because it is containing more CO2. So what happens? Then that time the diaphragm relaxes. Diaphragm is a dome. When it contracts, what happens? Diaphragm comes down. When it relaxes, it goes up. But when diaphragm goes up and intercostal muscles also relax, the anteroposterior diameter reduces, the vertical diameter reduces, so the total chest cavity size has become less. Now, when it has become less, the lung inside gets compressed. When lung inside gets compressed, the air inside the lung also gets compressed. So the pressure of air inside the lung increases, and that is how the air from higher pressure moves out to the atmospheric pressure, and that is how the expiration happens. So this is the mechanism of inspiration and expiration. Have you understood it? So now coming to the next. Okay. What is this? This is a picture of the tree in a desert area where all the leaves are gone and only branches has remained. Do you think it is a picture of a tree? This is not the picture of the tree. This is the picture of the alveoli, lung. All the alveoli are dried up, only branches are remaining. I told there are 7 crores of alveoli. So to get the idea that how many alveoli are there, that is why I have shown this picture. Now this is little more important. You are sitting normally. How much air you are breathing in? 500 ml air in and 500 ml air out. Suppose you breathe in heavily, you can breathe in 3500 ml air. Suppose you breathe in heavily and breathe out heavily, you can breathe out 4600 ml air. So that is called as a vital capacity. Suppose now you are sitting normally, not running, not walking, you are breathing normally. When you breathe out, your lung contains at least 2300 ml air. Suppose you breathe out heavily, rechak. Your teacher has given you order that rechak, pura सांस छोड़ दो. Still 1200 ml air remains into the lung. That means our lungs, they never become empty. Air is always there inside, and with each respiration, there is an exchange of gases. Now, a person who is doing a sedentary job, he is sitting at the hotel counter collecting money. What he will do? You will just breathe in 500 ml air in and 500 ml air out. Now, to such a person, if you tell, run and catch this bus, this is the last bus. If you miss it, you will have to sit at the bus stand for whole night. Or even you also must have experienced. Suppose you are when you are going to college and your lectures are over and you are coming out to go home. So you are chit-chatting, walking, and suddenly you say, oh, bus has come or train has come. So you start suddenly running. Try to catch the train or bus. Some of you might be able to catch the bus, but some of them, what happens? You go, I will come by the next bus. Why this happens? He becomes breathless. Why he becomes breathless? Because the person who is a sedentary jobber, who is sitting at the hotel counter or who is feeling breathless, his lungs, it is only opening to breathe in 500 ml air in and 500 ml air out. Now this person is asked to run. When he starts running, the muscles are working more. When muscles are working more, they require more oxygen for energy. How you can get it? When you will breathe in more air. But these alveoli, they said we are not used to it, we are not habituated. Their union leader is very strong. It has do only work this much, don't work more. So what will happen? To fulfill demand, he has to breathe fast. That is why he feels breathless. So if you want to avoid that, whenever you are working more, running or doing more strenuous work, when you require more oxygen, your alveoli should open up without any problem. You should be able to breathe in more air and your the oxygen demand should be fulfilled. Now this capacity can be improved by doing Kapalbhati. Now how this is happening, that we'll see now. When you do Kapalbhati, normal inhalation and forceful exhalation. When you are doing forceful exhalation, whatever dust particles are there which have been inhaled during inhalation, they will be thrown out. If they are thrown out, whole of this passage will become clean and you will not have any difficulty in breathing. Now these dust particles are thrown out. As I told you, when you are inhaling, the dust particles are inhaled, which contains the bacteria, virus, organism. If dust particles are thrown out, along with that, the bacteria, virus is also thrown out. So if they are thrown out, they will not remain here. If they don't remain here, you will not get any infection into the respiratory tract. So chances of getting cough and cold, allergic rhinitis, all that can be reduced. So this benefit you get by doing Kapalbhati. Suppose some organisms remain over here, they will grow. What is the favorable atmosphere for the growth of the organism? As you know, if you keep your house totally clean, you will not find any mosquito over there. But you will find mosquito where? At your backside of the home where the drainage pipe is leaking. Because there is a favorable atmosphere for the growth of the mosquito. Similarly, in the respiratory tract, water and dust particle combination is the favorable atmosphere for the growth of the organism. Now you are doing Kapalbhati, dust particles are thrown out. So one atom is gone. Second atom, I told you, in 24 hours, 1 liter water is secreted over here. More than 60% water is utilized for moistening the air. Remaining water, if it remains over here, it will combine with the dust particle and form the favorable atmosphere for the growth of the organism. But when you are doing Kapalbhati and Ujjayi, the heat is generated. Because of the generation of heat, remaining water is there, it will be evaporated. So that water will not remain. The second atom is not there, favorable atmosphere is not there, and organisms will not grow. So that is the benefit of the doing Kapalbhati. Every day morning in the police or home guard, there is a parade. Why there is a parade? Because the whole day they have to stand and do the work. So early in the morning, by doing parade, you are making them tired. It's not making them tired. It is warming up to make your muscles strong, so that they will be able to do work um, strongly whole day. Similarly, in Kapalbathi, if you practice every day in the morning, all these muscles are made alert. The dust particles are thrown out, so they will be able to perform the duty normally whole day. So you will not have any deficiency in oxygen to all the organs. So this benefit you get by doing Kapalbhati. What more benefit you get? Suppose you start rubbing like this on your hand. If you do it for 10 minutes, what happens? It becomes red. Why it becomes red? Because of the continuous rubbing, the blood supply to this part increases. The blood vessels, they pour more blood. Similarly, when you're doing forceful exhalation, where air goes out, it rubs the mucosa. When it is rubbing the mucosa, the blood circulation increases. Now, 1 minute. When the blood circulation will improve, what are the contents of the blood? RBC, WBC, white blood cell. In that, important the polymorph. Now, what is the function of this white blood cell?
So it
Whenever
acts as
there
a
are
defense system. So it acts as a defense system. Yeah, immune system.
Yeah.
Immune system.
How that is what I'm telling you. How the immunity improves it. Now, these dust particles contain organism, bacteria, virus. Now the white cell has got the phagocytic action. Means, suppose this is a bacteria, virus, and this is a WBC, white blood cell. When it comes in contact with the organism, it changes its shape in such a way that it engulfs the bacteria and kills that. That is called a phagocytic action. So if it kills the bacteria, what will happen? That means your immunity has improved. When you are doing Kapalbhati, forceful exhalation, when the blood circulation of this mucosa increases, the WBCs, they will be active. So whatever dust particles, organisms are there in this path, they will be killed and your immunity will improve. You will not get respiratory disease. So this benefit you get by doing Kapalbhati. What more benefit you get? You must have inflated a balloon for your children, isn't it? Suppose you take a balloon and you apply it to the pump. How you try to inflate the balloon? You put half pump, isn't it? Do you put full pump like this? If you put full pump like this with pressure, the balloon will burst open. So what you do? You do half pumping so that slowly balloon inflates and you get enough size of it. Similarly, when you are doing Kapalbhati, there is a normal inhalation and forceful exhalation. When you do forceful exhalation, the alveoli closes. And then you do normal inhalation. So slowly alveoli open up, inflate, and the elasticity of the alveoli is maintained. Now, whenever you want to, you are running, working more, you want your oxygen demand has increased. These alveoli, they should open up, distend easily, take more air inside, and then the oxygen intake increases and you will not get deficiency in oxygen. So all this depends upon the elasticity of the alveoli. Now for previous discussion, we have seen that the lung capacity 4,600 ml air. That is called vital capacity. We can breathe in. But normally you are breathing in only 500 ml air. means only 1/8 of your capacity. So only 1/8 of the lung alveolar opening, other alveolar, they are sitting quiet, dormant. They are not doing any work. And if they are not contracting and relaxing, their elasticity is hampered. For example, you take a rubber piece, make 2 pieces of it, and one piece you put into the storeroom, and other piece, every day you stretch it, apply oil to it. After 1 month, if you pick up the rubber piece in the storeroom, you will find that it will break on its own. It has become brittle. But the piece which you are stretching every day, it will be elastic. Similarly, if you are doing Kapalbhati every day, all the alveoli are opening and closing, so their elasticity is maintained. If the elasticity is maintained, they will open up whenever you are in need of more oxygen. So this benefit you get by doing Kapalbhati. Now, when you are doing Kapalbhati, the lower abdomen is moving, because forceful exhalation you have to press the lower abdomen. So when it is pressing lower abdomen, intestines are getting pressed. So the mesentery, the fat into that mesentery also is moving. So it melts and the abdominal size reduces, your tummy reduces, Madhya Pradesh kam ho jata hai. So this will help to improve the digestion also. So this benefit you get by doing Kapalbhati. So how many benefits we have seen? Elasticity of the mucous membrane increases, blood flow increases, and immunity improves. Dust particles are thrown out, so you will not get any respiratory disease. Air tubules are open up at the highest capacity cleaned, so elasticity is maintained. Then dust particles along with the organs are thrown out, so less chances of getting disease. Dust and mucus gives a favorable atmosphere for the growth of the organism. Both the particles are thrown out, so favorable atmosphere is not there, and you will not get any disease. The elasticity and tone of the alveolar wall is maintained, so that whenever you require more oxygen, they will open up without any problem, and you will not get breathlessness. So then all respiratory reflexes are made powerful. The respiration is controlled by the inspiratory center and expiratory center. Whenever expiratory center is put on, you try to exhale. When inspiratory center is put on, you try to inhale. Now, when you are doing voluntarily inhalation and exhalation, those centers are activated, so their function improves. Then, because the dust particles are thrown out, total passage, tracheobronchial tree becomes normal without any obstruction, so you don't get any difficulty in breathing. Then one more benefit. When you are doing Kapalbhati, and all your yoga teachers, so you must have been taught to do Kumbhaka, isn't it? What you do in Kumbhak, you put a Jalandhar Bandha. Now you are inhaled, you are done Kapalbhati, and either you are done Antar Kumbhak or Bahya Kumbhak. Whenever you do Kumbhak, what you do? You put a lock over here, Jalandhar Bandha. So what will happen? Air cannot go out through this. It gets trapped. Now air is a volatile thing. It is not a static, it is dynamic. So what will happen? Air will try to move from one alveoli to another alveoli in search of the exit. But it will not get, it will not find the exit, because here you have put a lock. So air in search of exit, it will move from one alveoli to another alveoli, and it will open up more and more alveoli. So what will happen? Your lung capacity will improve. The elasticity of the alveoli will improve, and the lung capacity if improves, you can get better oxygenation. So this benefit you get by doing Kapalbhati. And one more last benefit, deviated nasal septum. The bone inside the cartilage inside the nose increases, or it is deviated on one side. So that is why what happens? You get difficulty in breathing, because they cannot go in. If you are doing Kapalbhati, 100 strokes in one set. Because of that, the excess growth of the cartilage, it gets rubbed because of the friction and size reduces, and you need not have to undergo surgery. So these are the benefits of Kapalbhati. So every day you should practice Kapalbhati. The thing is that you should not practice it more than 100 strokes or 120 strokes maximum in one set. Such you can practice 3 sets. Now, who cannot practice Kapalbhati? Again, same contraindication. Who has got high BP, heart disease, abdominal hernia, major abdominal surgery, glaucoma, gastric ulcer, complicated ulcer, severe back pain, and pregnancy. Now, what they can practice? They can practice simple Kapalbhati. What is simple Kapalbhati? The traditional Kapalbhati is normal inhalation and forceful exhalation. Now, in simple Kapalbhati, it should be without forceful exhalation, so that the intestines are not pressed, they will not press on the heart, and you will not get any problem. So this is simple Kapalbhati without forceful exhalation that they can do. So these are the pros and cons of the Kapalbhati. If any question, you can take 2-3 minutes more and then we'll stop.